Good evening, everyone. Good evening, guys. Thanks for joining us. It is Fertility Talk Live, and tonight we are talking about PCOS. Yes, we've done the topic before, but like I said, there's always more ladies joining. Thanks, Rose Stone. Thanks for joining us always. Simone, thanks for joining. Hi, good evening. We're talking to Adele, and Adele is from Sinopol. Hi Adele, see you there. I'm going to invite you in just a minute. So Adele is from Sinopol, and we're just going to send an invite, and we're going to talk about its reproductive health. We're going to talk about PCOS and supplements and answer as best we can. So we'll just wait for Adele to come on. There we go. There you guys. Okay. So just wait. Here we go. Hi Adele.
Hi Leanne, how are you?
Good, and yourself?
Very well, thank you. And yes, I'm pleased to join you tonight. This is quite exciting for me.
Thank you. I was just looking at your old video you did, I think it's last year or the year before. And Sinopol's video, your video has actually gotten over 1,500 views on YouTube, which is quite, it's quite good. But the thing is, it's talking about PCOS. And I think a video on PCOS is always something that does well, because there's so many women that's dealing with PCOS. They don't know what supplements to use. They don't know what it entails. And I think your video was very informative. So we're really looking forward to this talk tonight, and give us some insight on this and how we can better manage PCOS. So if you don't mind, if you can just introduce yourself to everyone.
No problem, Leanne, I will. So my name is Adele Bale. I am a brand manager working for Inova Pharmaceuticals. And I had quite an interesting journey when I joined Inova. I joined them and I was given the responsibility of launching and managing a product called Sinopol. And at that stage, it was quite daunting to me, as well as I'm sure PCOS or PCOS is to most of you that's here tonight or that's attending, because I've never heard of it before. I've never had it, or I wasn't aware of it. And this was something that I really had to play out in my mind. And I've done a lot of research, I've done a lot of reading, a lot of clinical papers, and trying to decipher it for myself so that I can understand it, and then I will be able to explain it to everybody else. So it's really explaining a route, or coming from a place where most probably all consumers are, and everybody that don't know a lot about PCOS, that don't know that you have it. And I don't know, I can't see how many. It's the 29 people that's joined. Am I correct if I'm saying that? Can you see how?
No, so it will show different on each person's. Okay. It shows different.
All right. So I'm not 100% sure of everybody tonight that they really do know polycystic ovarian syndrome, or in short PCOS, or whether they are just interested to listening about infertility and what we have to say. So I will most probably try and do my best to decipher the infertility associated with polycystic ovarian syndrome and where that actually fits in.
Thank you very much, Adele. So the first question we talked about is, what is PCOS? Maybe you can just explain it a bit more, because like I said, a lot of women don't actually know that they have PCOS.
That's correct. Yeah. So I think I would most probably go to how prominent and how prevalent this actually is, because to me, in my mind, if I know how many women battles of PCOS, then it makes it quite relevant, and it makes it quite important. And there's about 15% of the female population, which accounts to about 10 million women across the world, that is battling of polycystic ovarian syndrome. And they just don't know it. It's about 85% of women, that's what the statistics tells us, of women that's been diagnosed never knew that they even had PCOS. So it's really something that's, I think, a lot more common than what we anticipate, or that what we think it is. And it's just because women just don't know what it is. I've been having the symptoms all my life, and I never knew what it is. And it's just trying to put it in a little box and and understand it a little bit more and equip yourself to know more about it, and then to understand what are the different options that's there and that's available that you can consider to use. Yeah, so
Okay.
I think then, and so once we understand that it is quite prevalent, then going to what is PCOS, and that's basically, which I think many people might know already, that is on these platforms and actually reach out and search, they would most probably know that it is a hormonal disorder, and that is quite a common thing. But it's not just stopping there. It actually involves so many other disorders or associated diseases. So if I can just maybe touch on all the metabolic abnormalities. And when I'm talking about metabolic abnormalities, that's a big, you might not know what that is. All what that means is actually, it's a whole lot of processes that takes place in our bodies and that happens, that makes our bodies work, and it produces energy. So it's a whole lot of things. And some of those disorders is insulin resistance. So insulin resistance is really when your body are battling to absorb the glucose whenever we are putting food in our mouths. That is what we, when we are taking insulin in, and that is what our bodies are really battling to absorb it. And that's one of the biggest, I would say, components as well that's contributing to PCOS, because PCOS is causing insulin resistance and insulin resistance is causing PCOS. So it's a big, massive, vicious circle that's happening in our bodies. And then the other thing is dyslipidemia. It's big words. I know that you warned me, don't use the big words. And I know when I started reading about all these big words, I also wanted to know, what does it actually mean? So that is basically when your levels of cholesterol goes high in your blood, and that increases the risk of causing clogged arteries, that's leading to heart attacks, that's leading to strokes. Those are quite serious things that can happen in the later stage in your body. And then also looking at hypertension. What is hypertension? It's basically high blood pressure. It's really things that you don't want to have when you're getting into your metabolic years. And then excess weight. Excess weight is causing insulin resistance. Insulin resistance is causing excess weight. So that's really a whole lot of things that's taking place in your body. So, and that is just some of the processes that's happening in our bodies when we do have PCOS. But I think if we look a little bit further, in terms of symptoms, what are the things that we actually see? I think it's quite important to understand that it's not to say that you're going to have all the symptoms when you've got PCOS. So PCOS may present with different symptoms in different stages of your life, and it actually affects you throughout your entire life. And I think that's quite important to understand, that you don't have to have all the symptoms. Yeah. And it basically starts from a very young age, but it only starts to present when you're getting into your adolescent years. And then it also affects you moving to your reproductive years and then moving into your metabolic years. So the symptoms and the common things that we are seeing when we are in our adolescent years, it's basically your acne, your hair starts to fall out, starting to pick up weight, you get irregular menstrual cycles and you don't know what's going on, and your hormones are just up and down everywhere. Your hair starts to get oily, and that is basically one of the main reasons for all of those symptoms, is when your male hormones are a little bit higher and you've got an excess of your male hormones. And it's a big word, it's hyperandrogenism, and that's basically what it is. You've got too many male hormones, and then that is causing all of these effects or symptoms that you are having when you're going into your adolescent years. And then that same person, when you're on your adolescent years, move and you're getting a little bit older and you're going to your reproductive, you're starting a family and you want to fall pregnant. And many times these women or these ladies are on contraceptives, and your contraceptives helps to balance your hormones. So you won't really know that you are having these issues. And then when you want to decide to start a family, you basically stop your contraceptives and then you don't menstruate. And then you cannot understand what's actually happening to you and why you're not menstruating. And that's because you're not ovulating, and that's the hormonal imbalance that's causing that. So, and it can become very, very complicated, and I really tried to do diagrams as I wanted representatives and people to understand in layman's terms to people actually exactly what are the systems that's happening. So I won't be able to explain all of that to you because it does become a little bit more complex, and I need a whiteboard behind me, and I need to draw pictures. But I'm trying to make it as simple as possible and to minimize the complexity of it. And then when you are in your reproductive years and then you don't ovulate because of this hormonal imbalance, then you cannot menstruate, and then you won't be able to fall pregnant. So then you are sitting with the infertility situation. So you might think that you are infertile and you actually just have polycystic ovarian syndrome, which can be managed. So 90 to 95% of women who do not ovulate have PCOS. That is quite a lot. It's a huge number. And that huge number or percentage can actually be managed. And it's not to say that you're never going to fall pregnant. If you just know what you have and you manage it in the correct way, you can definitely fall pregnant. Maybe I'll tell you a little bit personal story, which I always feel like if you have a personal journey or a personal story to tell, like yourself as well, and that is exactly why you're doing what you're doing tonight, then it makes it a lot more relevant and a lot more present in your own life as well. And then when that same woman, when she's not in her reproductive years, moving to her menopausal years, then all those metabolic diseases that I spoke about a little bit earlier with the high cholesterol, the high blood pressure, and all of those symptoms are starting to become prevalent in those menopausal years. And that's quite a huge risk because there could be quite a lot of serious consequences that you might face when you are sitting with all of these diseases and they are not being managed. Yeah. So
you were saying you're going to tell a bit of a personal story.
Okay, so that is when I spoke about when you are going off contraceptives in your reproductive years, and then you stop menstruating, you don't know what's going on. So I started working with Inova. It was in August in 2019, I started working there, and my sister's husband's niece, she studied to be a CA, and she got married, and they were here for a couple of years, did a lot of traveling, and then they immigrated to Amsterdam. She got a position there. And then all of a sudden, when she's there, it's a different country. The medical system works slightly different. You don't know where the doctors are. They've got a national health insurance system. So it's slightly different the way it works here. And, you don't have a doctor to go and get your 6-month contraceptive prescription. She decided, well, she's just going to go off the contraceptives now, and if she falls pregnant, then it's fine because they've been married for a while, they traveled a lot, so if she falls pregnant, then it's actually quite good. So they're going to start and planning a family. And then she never menstruated. She couldn't understand what was going on. Also never knew about PCOS, never heard about it, and it took her about 8 to 9 months to be diagnosed with polycystic ovarian syndrome, eventually by a fertility specialist in Amsterdam. And that was around October, and I started working and managing Sinopol and polycystic ovarian syndrome in August, and that was just wow to me. So I obviously told her whatever I possibly knew at that stage and what I've learned and what I've read, and I told her about everything. I told her about Sinopol as well. And then she had a colleague that came visit Cape Town that next year, February. So I bought her 6 boxes. I packed it in a nice box and I sent it to the B&B where the guy stayed, or her colleague stayed. He took everything out of the boxes. He just took the sachets back. So must have, I don't know what the people thought when they saw all those sachets in his bag. But then she started taking it, and I said to her, well, just take it exactly the way I tell you to take it, and you don't deviate at all from that. Yeah. And it was just over a month it was about 6 weeks when she sent me 6 to 7 weeks when she sent me a picture of they went for a scan, and she sent me the pictures of the scan, and she fell pregnant. Wow. And that was actually absolutely amazing. After 14 months that she never ovulated and she never menstruated, after a month that she took Sinopol, she started menstruating, and that must have been her first cycle that she actually ovulated. That was very, very quick. Normally you have to take these health supplements for a 3-month period before it starts to work. But she just religiously took it exactly the way, and that was the only thing that she did different. So there's definitely hope at the end of the tunnel. People need to, I think, when you've got PCOS and you've been diagnosed, it can become quite daunting. It can actually affect your not just your physical appearance, but also emotionally. I think it's quite a big thing that can affect you emotionally. And I mean, you are one of the people that speaks out of experience because you've walked the journey yourself. But there's definitely help at the end of the day that you all can try to see whether it's not working for you. Yeah. So I think when I try to decipher how all of this fits in, and when I needed to look at data and how data supports a product on these different areas, I basically broke it into 4 pillars that make kind of sense for me. The first one was the hormonal imbalance side, and then it was insulin resistance, because insulin resistance is a big part, and it influences and it affects, it causes PCOS, and PCOS causes insulin resistance as well. And then hyperandrogenism, like I said, this whole imbalance of hormones is causing, as well as insulin resistance, is causing your male hormones to increase. And basically that was a big pillar for me. And then oxidative stress was the 4th pillar. So I never kind of knew. So oxidative stress, what does it mean? And I just tried to make it practical for myself. Basically what oxidative stress is if your body metabolizes and it makes energy, there is free radicals that becomes available. So when you're doing excessive and a whole lot of exercising, your free radicals become small, and that free radicals causes inflammation. And the analogy that I use to explain to people is when you're actually cutting an apple in half, and you leave that apple, when you cut it in half, it's white and it's fresh and it's still firm. And when you leave it for a couple of hours and you start seeing it's becoming a little bit darker, when you leave it the next day, it becomes more darker. And if you leave it for about 2 to 3 days, you'll start to see that apple starts to shrink. And that is basically what free radicals are doing to our cells in our body. And then it causes our cells to die at the end of the day. And that is causing inflammation in our bodies. So oxidative stress in polycystic ovarian syndrome is a big factor. And that's why you need to make sure that you're getting enough antioxidants in as well. So if you look across these 4 pillars and you look at the prevalence of all of these areas, it's quite high. So from your hormonal imbalance perspective, that you don't ovulate and you don't menstruate, 90 to 95% of the women that don't ovulate have PCOS. So it's quite a high number. If you look at your insulin resistance, at 50 or 80% of your PCOS women have insulin resistance. So a lot of the PCOS women have it. Your hyperandrogenism, your increased male hormones, that you'll see in about 60 to 80% of women with PCOS suffer from hyperandrogenism. As that is your typical your acne, your oily hair, your hirsutism, hair starts to fall out in different ways, normally in your hairline. You're starting to get unwanted hair growth, and these are all kind of those are I think the most embarrassing kind of symptoms that we have. And I've spoken to people when I was at the fertility show Africa, that women walk in there with their husbands, and they are just, you just really feel for them, because it's such a sensitive issue. It's very, very hard and difficult to talk about it. And I think that is why it's important to have these kind of forums that people can actually join and speak about it, and just know that they're not the only ones. So these are all big things, or high percentage things that is visible in these women. When you're getting unwanted hair, and I'm talking unwanted hair, it's not just when you're a Greek and your hair is dark and your moustache is a little bit darker. It's like really getting unwanted hair where your males are getting hair around your nipples, hair on your toes, hair on your chest. And it's not just soft hair, it's like hard, dark hair that you actually grow. And those things are really it's just so devastating to have all of those symptoms. And I think from an insulin resistance perspective is, how do you see all of these things? How do you know it, and how does it become evident? So your insulin resistance is not to say that just overweight people might have insulin resistance. It's about between 55 to 70% of your patients that that are obese, that have or a little bit weighing a little bit more, that's got insulin resistance. But your woman that is tiny and thin, there's about 15 to 30% of those women that can also have insulin resistance. So it's not always just related to excessive weight and increased weight. You also see in a lot of the patients from an insulin resistance perspective, how you can see it. You see these dark marks around your neck and underneath your arms as well. You can also see those dark marks, and that is all things that's increasing your male hormones, your hyperandrogenism. So that's why I say all of these 4 pillars are interlinked with one another, and they all are affecting one another. And then when you're picking weight, you get visceral fat. It's mainly your fat around your waist area, that real tube that you have. When you have that, then you most probably know that is your visceral fat, and that is caused by insulin resistance. And that visceral fat is then also increasing your hyperandrogenism, your male hormones. Yes. So, and I think when I played it out and I divided it in those 4 groups, and I've put the different symptoms that you can get underneath those 4 pillars, then it started to make a little bit more sense for me. And then you start looking at what you can use where there is clinical data in all these 4 areas when you need to decide on a treatment.
Is there a cure for PCOS?
Let's start with the cause. There's not a specific tentative cause what's causing this, and there's not a cure. And I think that is the difficult thing, because you have to manage your symptoms always. There is definitely quite a lot of products in the market that can manage these symptoms. Now, I think that's the reason why it's so difficult, is to understand why can't this be cured. And there's a lot of research that's already been done in this area. And all that you need to do is you need to try and basically balance your hormones. From a diet perspective, when you've got polycystic ovarian syndrome, I think it's very difficult to diet. I think it's very discouraging when you are dieting and you don't lose weight. Because that's not the reason why you've got excess weight. The excess weight is because of your insulin resistance. It's not because of you just eating not well or not having good eating habits. It could be, but it's not necessarily to say. But following a healthy diet and to exercise will definitely help, because every little bit that you lose from a weight perspective will help to alleviate all these different symptoms that you are getting from your insulin resistance, from your visceral fat. But I think if you first need to understand not to get despondent and not to get negative, because that's not the main reason, is rather to try and manage it and find ways that works for you. And we're all different people. So what works for one might not work for another one. And I think it's amazing to tell testimonials and for people to say, well, this has worked for me, but it might not work for you. You might find something else is working for you. And you know, there's various products currently on the market, and people are free to use some of these health supplements. Yes, we've got Sinopol, and I can tell you a little bit more about Sinopol as to how it works and why it works. And then you've got it available on your in your store as well. Yes. So I've just told you my personal story where Sinopol has worked. Normally they say, or they expect, that you should use these health supplements, especially when you're using health supplements, for a period of 3 months in order to make a final decision, or a final what's the right word, making the final decision, yes, whether it worked or not. I think you need to give it about 3 months time. From what I've personally seen, where a lot of the people and the representatives in our company and their families, where they've used Sinopol themselves, they started to see a hormonal effect within 2 weeks, if you actually take it the way you should take it and take it religiously. But like I said, we're all different people, and things work differently in different people as well. So
maybe we can, sorry, Adele, maybe you can just touch on like how do you manage your PCOS with Sinopol, and how would you take, because I think how you take it, that's a question I always get is, I've got this product, how do I use it? So maybe you can just enlighten us on that.
I think that is quite important, and it's something that I've stressed everywhere. When you listen to me, that's what I also say. It's got to be in your bloodstream to work. So you've got to make sure that you actually take it before you eat. So you need to take it. It comes in a sachet, and you need to take 2 a day. That's when you see the best results. And you need to take it preferably an hour before you start eating. So what I normally say, my daughter is on Sinopol as well. So what I say to her, and what she does, is she normally takes a little bit of water in a small glass, put it next to her bed, and put a Sinopol sachet next to her bed as well. Tomorrow morning when she wakes up, she just puts the content inside the glass and stir it and drink it. And then by the time that she's having breakfast, then that's already being absorbed in her body and already starts to work, because it needs to work by the time that you're actually putting insulin in your body. Then it already needs to help absorbing that insulin, the glucose that you're putting in your body by your food. And then you need to take it again in 10 to 12 hours time after that. So in the afternoon, around about 5 o'clock, you can take your second sachet, and then while you're cooking, that's busy working, and then by the time that you're having dinner, then it's working already. So Sinopol sachet, when you put it in your glass, you'll see that there's some yellow granules, and those yellow granules are not going to dissolve. That's the alpha lipoic acid. So there's 3 ingredients in Sinopol. There's alpha lipoic acid, there is myo-inositol, and there's folic acid. The magic happens when you put alpha lipoic acid with myo-inositol, and that works in whether you have familial diabetes in your family or not. That works best and the same in both groups, and it's one of the only ones that's working in both groups. So you'll see once you start stirring it, it takes about 9 or 10 seconds. Then the consistency of the fluid becomes slightly thicker, and the reason for that technology is to make sure that it disperses those yellow granules, to make sure that you're actually taking them in. And that alpha lipoic acid is a slow release. So when you're taking a normal alpha lipoic acid vitamin or substance, it's not necessarily in a slow release. So Sinopol has a special technology, and that's why it's patented as well, that allows that alpha lipoic acid to work for a full 12 hours. So normal alpha lipoic acid that you take in only works for about 40 minutes, because the half-life is only between 3 and 4 hours. And if it only works for 40 minutes, it can't do magic only for 40 minutes. Whereas the alpha lipoic acid in Sinopol has got a slow release. So when you take it twice a day, then you know you've been covered for 24 hours. And that's what the alpha lipoic acid does. And that's how you need to take it. And that's quite important. We've had many questions. Do I need to dissolve it in warm water? No, you don't have to. The granules is also not going to dissolve in warm water. So I think that's quite important. And then you've got to take it every day. It's very difficult because people are not great with compliant. But if you make a choice that this is what I want to do, because I really want to make sure and see whether this is working for me or not, you basically have 3 months. So one of our representatives, nail technician, was in Sinopol for a month and a half. And then she phoned me and she said to me, what must I tell her? And it's very difficult because we can't always dictate what people need to do. They always need to consult with a healthcare professional. So she went to the gynae, and the gynae said to her that she needs to fast the day before the time. The next day they want to take blood tests, and then she wasn't sure whether she should take it or not, or rather leave it. So I advised her that I don't think she should stop it, but she needs to inform a healthcare professional or a gynae that, and rather ask her whether she should carry on with it or not. And so she did that, and the gynecologist said to no, she should rather carry on with it because she's already down the journey with a month and a half's treatment. And it was about 3 weeks after that visit, then the representative let me know and said to her, her nail technician is pregnant. So that was just, it's like, there's many of these stories that I can tell, that people came to me, or the representatives, and doctors themselves that used it, representatives in other companies that used it as well. There are really, really good stories. So your alpha lipoic acid in the combination is really one of your best antioxidants currently on the market. And for a simple reason that it also regenerates other antioxidants like your vitamin E and your vitamin C. So that is when I spoke about the oxidative stress pillar, that is where alpha lipoic acid will also work. from an insulin resistance pillar perspective, your alpha lipoic acid is going to help your glucose to be absorbed in your body. So it will help your insulin resistance from that perspective. And then when we're going on to your myo-inositol, that will also then mimic the mechanism that actually helps and supports the uptake of insulin in your body. So big thing with alpha lipoic acid and myo-inositol that affects the insulin resistance in your body. So, and for that reason, when you are a diabetic patient and you're on diabetic medication, you have to tell your doctor that you are going to take Sinopol, because he's going to have to measure your sugar levels, because it actually does work. So that's very, very important to understand that and to know that. So your myo-inositol, like I said, it's also helping with your insulin because it's a mediator. And what it also does is promoting good quality oocytes. So if you are making sure that you've got a good quality egg cell that needs to be bevrug. What is bevrug in Engels? Needs to be fertilized.
Sorry?
It was just, I need to get to an English word. When that egg cell needs to be fertilized, the better the quality of the egg cell is, the better the chance is that that egg cell would be fertilized, and then obviously grow as well, and then grow into a fetus. So your myo-inositol is also an antioxidant, so very, very important. And while it's doing all of those things, it's balancing two of your most important hormones that is going into an imbalance that's being released by a pituitary gland in this whole PCOS cascade that's affecting everything. So it's then helping to rebalance those two hormones. So one of the other reasons why I divided PCOS symptoms kind of in those 4 pillars is because Sinopol has got clinical data in all of those 4 pillars supporting all the symptoms. And I think that is just absolutely amazing to have the clinical database behind this product. These clinical trials have been done on Sinopol itself. So we've really seen good results both in all 4 areas, with hormonal imbalance, with especially when you are on IV treatment as well, where it's really affected and supported those where they looked at people that with IV without Sinopol and IV with Sinopol, and the chances of falling pregnant was 44% higher with the group that took Sinopol. And then within your insulin resistance, there's a reduction in your BMI, there's a reduction in your weight. So it works in that area as well. Then hyperandrogenism, we've got 40% reductions in serum and androgens and testosterone. There's various clinical trials. There's quite a whole lot of group that is showing results in how it reduces the testosterone levels. And then, like I've already spoken about, the oxidative stress, it is one of the most powerful antioxidants currently on the market. And yes, that is the active ingredients in a nutshell. I've explained how to take it. It is available in all the discounts. So if you can't find it, maybe in a Clicks or in a smaller independent pharmacy, then discounts, all the discounts do have. But if they don't have it, they can always order for you because it is available at all the wholesalers.
Then if you don't mind me asking, I've got a question from one of the ladies. Is could it lower your glucose levels lower than it should be? I don't know if it makes sense.
So it depends. It depends whether you are diabetic or not. If you're not, then it won't. Remember, it's a health supplement. It's not medication. It's just a health supplement. But if you are diabetic, you need to make sure that your healthcare professional do know that you are going to take Sinopol, because he needs to measure your sugar levels.
Okay. And then I've got another question is, so for ladies that, okay, I'm just going to say it's for me. So I'm currently on the metformin, and I've been taking it for months, like over a year. But the last few days, it's been making me feel a bit funny, and I've actually stopped it for 3 days now, and I actually feel better without the metformin. If someone is trying not to conceive, could it be taken just to help me with the my PCOS, basically to manage my PCOS? So if you're just trying to manage your PCOS as well, is it something that you can take to just manage, and if you're not just trying to conceive?
Yes, you can. It will definitely work. So the professor that's done a lot of research on Sinopol is a gynecologist as well as an endocrinologist in Switzerland. No, in Spain. Sorry, in Spain. And he's taking Sinopol himself as well. And I really enjoyed speaking to him. So he's an independent professor. He's not involved with the product, but he started using Sinopol right in the beginning. That's how he told me how he was introduced to the product. So he had representatives coming to visit him and they introduced Sinopol to him. Then he started to use it on his patients. And then he realized that there's something happening here with these insulin resistance patients, because he's an endocrinologist, so he's got obviously a special interest in insulin resistance. And then he approached the company and asked them whether they couldn't, well, he would like to do clinical trials on Sinopol. And that is, like, all the insulin resistance clinical trials were done by him himself as well. And he said to me that Sinopol is the best insulin sensitizer currently on the market. So he is using Sinopol for one of the three reasons why he's using it is because he stays in Spain. They're eating bread and pasta every day, and says his body just cannot deal with all of that, and that's why he's taking it. And he's also taking it for his muscles and for his brain. And for his muscles is obviously because it helps to uptake the glucose in his body. And then his brain, he referred to alpha lipoic acid. So I did a bit of research on alpha lipoic acid. When you read about that, that's got some positive effects on any neurodegenerative diseases like Alzheimer's and all of that. So, and because it's it's a potent antioxidant too. So it's really my personal opinion, a good product to make sure that your hormones are staying balanced.
Okay. I've got one last question.
Maybe
so a lot of women...
just before you're carrying on with the question, just with metformin, they've also done a clinical study with Sinopol on metformin patients that's been on metformin. Then obviously the higher your dosage is in metformin, the more side effects you are getting. So they kept the same group on higher metformin, and then another group with a lower metformin where they introduced Sinopol, and the results was pretty good. It's quite technical when you go into the results, but that was quite good. So that's an option as well. Obviously, you need to discuss that with your healthcare professional, because he needs to monitor and manage that as well for you.
Yeah. A quick question. I know there's certain products you can actually put it on your medical aid as well. Is Sinopol one of those products that you can actually get what's the code that you get for it?
Code?
That
NAPI code?
So the NAPI code,
if it's NAPI coded, then you can claim for your savings from medical aid, and Sinopol does have a NAPI code. Yes.
Okay, so to the ladies that are on here that maybe want to claim it from the medical aid, you can do that. And you can just get a NAPI code. I don't know how that works, but maybe I'll try and find that out for you. And you can actually buy that.
The dispensaries know that. So when they put it through, the NAPI code is being loaded with MediCredit. So that is all linked with the dispensaries and the pharmacy. So that will automatically.
Awesome. That is very great. That's great. Thank you very much, Adele. This has been really, really a great conversation.
Another positive point of Sinopol as well, it really tastes quite good. I know it's quite a compliance issue if you have to take something and it doesn't taste well. So there's really no problem with, I'm sure you will be able to, you will agree with me when you taste it. It really tastes good.
Awesome. Thank you very much, Adele. I think you've answered quite a lot of questions for us. And it's nice to hear that there's science behind it as well, that you could give us the data that you've got as well, which is quite great. So thank you very much for that. Chefs is saying thank you very much. It's a pleasure, chefs. Hope Adele answered your questions there with that. So again, if you guys want to buy it on your medical aid, you can, because like I said, there's a lot of times women ask me that, can they claim it back? You can claim it back from medical aid. Speak to your pharmacist. You can get it at the schemes as well. And you can be able to buy it that way. So thank you for the talk. Thank you for taking the time out to do the talk. I know you're a very, very busy lady. I was very surprised that I could actually get hold of you and do this talk. But we really appreciate it, and have a great evening, Adele.
It's a pleasure. And just with a closing note, if you need more information, you would like to read further as well, then you're more than welcome to visit Sinopol's website. It's just www.sinopol.co.za, and there you will also find a lot of information, and a lot of things that I've said as well will also be available there.
Perfect. Thank you very much. Have a great evening.
Thank you, Lily,
Thanks.
and the same to you.
Pleasure.
Bye-bye.
Bye. Bye, everyone.
Bye.